Good evening, everybody. How are y'all today? Um, I thought I was going to go live on Rumble, but it is having trouble getting started. That's what I've been doing the last few minutes. So I'll try to get the video uploaded from here to Rumble. If you want to check out my Rumble channel, it's under Big Dave 12 right now. It will be changing to Rich Runner Reports later on. Good evening. I hope everybody's having a good weekend this weekend. I know that there's things. Let me adjust this. There we go. Going on. I'm on here tonight because I've got I was asked to do this and kind of get the word out on as many platforms as possible about this Million Nurse March and what's going on. But there's been, of course, there's always leeches on every corner trying to benefit off of it or keep it hid and not let nobody know about it and trying to keep it all squished down. But I think they're having trouble with that at this point. I made a few posts this week. It got some mixed reviews. It's pretty harsh. I meant for it to be. It's what people don't understand is as much as rewarding as this industry is, it's also got its drawback. What's going on, Don? How you been, boy? So I'm going to start out. I'm going to say this. Once in a while in nursing, you'll run into people, specifically people that survey in your building. You run into them a good bit. If you run into them as much as I have in a certain part of the country, you get to know them. And it changes from what are you doing, what kind of work are you doing, what is it going on in your building to you get to know what their likes and dislikes are, and you get to know them on a more personal level than you do as surveyor and employee of a building or a contractor in a building, whatever the case may be. So it's one of those things where you start having discussions with them, trying to figure out how you can do your job a little bit better. And I got to be friends with a couple of the folks in Region 4 up there, and we had this discussion one day about how everything is coming around to what we had talked about. I was talking with a surveyor one day, and it said one day it's going to be where everybody has to stand up. I say that to say this issue that we're having right now, this Million Nurse March, everything going on, is just the tip of the iceberg with nurses. If we allow them to cap nurses' pay, who's next? Who else is going to catch hell on it? Will it be you want to cap what you call contract nurses rates? You want to go from there, and then you'll cap all the underlings and the medicine nursing side. You'll be wanting to cap out the LPN rates and the CNA rates and the MA rates and then we're going to have to cap the lab technicians and then the radiology technicians and then the radiologists themselves, and it'll never stop. People in the healthcare industry understand it. We've watched it happen over and over again. It takes anywhere from 50 to 100 people to run a long-term care facility, all the way from housekeeping to dietitians, all the way up till you get to the nurse. You've got to have all of that underneath you on your platform for a facility to run. That's including hospitals. So if nurses realize now, if we don't stop now, it won't stop anywhere. The line in the sand's being drawn. It's already drawn, and it's not hard. I tried to decide the best way to explain everything. So I sat down this week and I wrote a letter. I think that's the best way to do anything. But the problem is, once I got started, I didn't stop. So this whole episode is a letter to America explaining everything that's going on and why it's going on. So if you'll just bear with me, I'm going to read it and then I'm going to expound on stuff. So just give it a second to pull up. Dear America, I have a few questions for you to ponder. What if nurses don't show up to work tomorrow? After the initial shock, whose fault would it be? Would it be the nurses that didn't come to work's fault? Would it be the facilities that hire nurses to be nurses? Would it be their fault? Or would it blame fall simply on the government? These questions I shouldn't even have to be asking. This ain't questions that the normal public ask of themselves. But nurses, anybody in the medical field, have always wondered. And we've been hollering for years for safe patient staffing ratios. We've been hollering for years for on-site psych, because of the traumatic stuff we see actually does cause PTSD. And now, in the middle of a pandemic, where apparently the rule is by the government, if you don't do what we say, we'll come and shut you down. We'll fine you till you have to close your buildings, which is what's happening. So the medical field is on the verge of collapse. So we're going to use Occam's razor. It's a big scientific theory that the rednecks have a definition better than the one I looked up to try to explain it. And the redneck version of that Occam's razor is keep it simple, stupid. Because that's actually what I did in this letter. And not because people are stupid, but because the basis of the problem has been hollered about for years. And the best way to understand why nurses are like they are about it, it was really a simple fix. So I began with 3 questions. The first one is, if nobody showed, if the medical field didn't show up to work tomorrow, would it be the nurse's fault that they didn't show up? Nope. I've been doing this since 1992 in some form or fashion. I've worked just about every department, including maintenance and housekeeping. I've done everything, every part of it. Nurses have an innate ability to leave our feelings at the door of our jobs and walk in and take care of patients or residents, whatever field you're in, whichever side of medicine you're in, without thinking twice about it. We leave our bills, our kids' activities, our parents' health, our spouse's health, our kids' health, and we walk into a facility and we give you everything we got to those people for 8, 10, 12, sometimes 16 hours a day. We as nurses know sometimes we don't even have the luxury to stop and eat, much less pee. We don't have where outside influences can't ever come into play. because it would interfere with the care of the resident, and we might make a mistake and it have a unintended outcome. And that's just the beginning of the shift. That's not happen. All the fires that happen in the middle of a shift. That's not happen when a medical emergency in your family calls in. You can't go nowhere because there's nobody to relieve you, and you can't leave them high and dry. You can't turn over your keys to somebody else and leave, because then it becomes a question of abandonment. So we have all of that going on. And we talk about it every day. It's unavoidable. We've been talking about it before it became on social media a talking point at this time. So here's how it works with nurses. We spend maybe 5 minutes when we come in the door and get report. Then we spend maybe 5 minutes. Try to spend 5 minutes on each patient. If you're in any kind of medical report, it go 30 minutes or more, especially if you've got a lot of acuity with your patients or residents. You can have a long report. And then it don't matter how big a report you get. You're going to try to spend as much time as possible on a computer looking to see if there were orders missed, if medicines got missed from the day shift that happened right before shift change, and you got to get them started and readjust the times. Did the order get written right? Is there a new order that wasn't taken off yet? The medicine that they're supposed to. I mean, this is the stuff we go through at just the beginning of every shift. So we've already spent an hour and a half getting the shift together. Out of a 12-hour shift, now you're down to 10 hours. So you got 10 hours to give all their medicines at that 8 o'clock or 9 o'clock, 10 o'clock, whatever the case may be. Then you got to worry about all the extra times in between there and the end of your shift. And you got to get it aligned to make sure everything's going on. And then you want nurses to do all of this job and all of this work with no help, not enough help, not being appreciative of the help you got. And then you want us to get it all done and out of there before the clock ends your shift. And the whole time, we're still trying to figure out if a nurse or a doctor made a miscalculation on a dosage order. It's going to cause an adverse outcome. And for the hospital workers, I worked acute care for a long time. I was fortunate enough to come through where titles didn't matter. You didn't get any points, but titles didn't matter. If you were smart, knew what you were doing, you could work where you were needed. And I worked in the ER, mine was usually the clinic type patients that come in that miss the definition of the word emergency. And that's normally what I had, but once in a while you'll get them and then they'll crash. They go south quick. I thank God every day I had nurses that had been nurses 10, 15, 20 years that could teach me. And I'm thankful to everybody that did. I've got one in my head right now, lives in South Arkansas. She don't even know. I never told her. Probably going to send her a message on Facebook now because I just remember all of that. So we're doing all of this. And then you've got, and because I've worked long-term care, then you've got to worry about, did all the housekeepers show up? Does dietary, are they running behind today? Do they have all of their people show up? Because it's not just happening in just the nursing field in long-term care. It's in every department of long-term care. They are flocking away like flies. Oh, I almost said another Southern statement. They're running their way to flies to buttermilk. It's bad. It's getting really, really bad. Mid-acute care and long-term care is where it's at. Now, ICUs and ERs and all that, y'all have a bunch of young folks out there that want to do all that too. Because as far as I'm concerned, I did my time in the ER. It's y'all's turn. Um, I can't hold out for that stuff anymore. I can quote it to you if I'm not having to do nothing. I can spit out the procedures quick. You get used to them. We take on all this responsibility, and it's a ton of it. And nurses do it without question. No matter how bad it gets, nurses will put a smile on our face and try not to let you know that we got issues going on outside our building. So you might get better. So you'll have a positive outcome on your hospitalization. We don't want you to know what's going on outside, even in the hallway. We're trying to make sure you're there in the hospital and you're getting better. That's the most basic explanation I can give you to make you understand what nurses actually go through. Now, we do this all day, every day. Some people, I work 10, 15, 16 days in a row. Bless your hearts. I don't know how you do it. I used to do it. I don't even know looking back, how I did it. I don't. It's bad. Now that I've given you that basic explanation, and I hadn't even told you about the stuff we see. Man, the stuff we see, some days you don't see anything to write home about. There's some days you can't forget what you saw. You take it when you leave work. Every time you close your eyes, you see it again. I did that a lot with trauma patients when I helped in the ER. I've got a case from 15 years, 20 years ago when I worked in Northeast Louisiana. Guy got T-boned. I still hadn't. Every time I think about it and close my eyes, I see his face. That's been 15 years. According to all the definitions, that's PTSD. Well, surprise. Guess what nurses are starting to suffer from? PTSD, burnout, and depression. And nobody really cared until now. It's funny how that happens. Nobody actually cared until now, and we caring about ourselves. And we're sticking up. And nurses, that's fine if you want to stick up for just the nurses, but you guys already know well as I do, it takes all of us to get a patient out the door, including housekeeping and dietary. It takes all of us working together to make one patient have a positive outcome. And we all know, because we've all been doing without raises for years of any significance. I mean, you get a raise here and there, and I fight for every penny I want, and I get it. If I don't, I go on to the next place. Nurses are nomads. That's what we do. So you got that. Now you've got companies, big companies, and I'm not talking about no little companies. I'm talking about these healthcare corporations paying their CEOs tens of millions of dollars a year, and they're out there. It's all over the internet. I don't have to tell you, there's companies that have to release their annual intake and their annual expenditures, and that includes CEO pay, chief. I want to say DON because they are directors of nurses. Not that the directors of nurses ain't important. It's just that some of these corporations want to change the title to CNO, which means Chief Nursing Officer, and it's a title. And apparently, in the Southwest, that title gets you $1.9 million a year. And who are the main ones griping about capping these? Is these big corporations where they're paying their CEOs $10 million a year, and they're paying their CEOs $10 million a year and paying their CNOs $1.9 million a year. Now, if anybody's pay needs to be capped, see where I'm going? And I'll even come back to, this is a healthcare field. It's supposed to be for the public, the nurses and the people on the staff and the hospitals and nursing homes sit there and take the Hippocratic Oath. Everybody uses it. Everybody has the first line memorized. First, do no harm. Everybody that walks in the building says the same thing. First, do no harm. And you're griping because now all of a sudden we know our worth. It took, in my case, a long time, 25 plus years, and a pandemic to finally say, give you the good old middle finger and say bye. So the second part of my question was, is it the facilities that's hiring nurses to be nurses part of the problem? Yeah. Oh, big oh yeah. Oh, hell yeah. If I had a nickel for every time I had ever been told when I asked for a raise that it's just not in the budget. Well, why is that? Why would a nurse that walks in and asks for you to match the offer they got, which might be $1 or $2, it won't be a lot. It might be $1 or $2 at the most. And there's never, ever any room in the budget. Well, it don't take a genius to figure it out. Now, medical people understand that there's unforeseen circumstances and expenditures inside their own buildings that happen. We watch it all day, every day. We see radiology machines, CT machines, MRI machines, lab machines, portable machines, vital sign machines. Everything breaks down. We get that. We know that it does. But we also know that they'll use that as an excuse to say that's why you can't get a raise because our CT machine is down, or we had to order 4 more Dynamaps, and they cost $1,300 a piece. Okay. And you do all of that. So if you don't give a raise and you spend just $1,300 on, let's say, 1 Dynamap, but the nurse's raise was going to be $1,450 a year. That's what it basically boils down to. When you start talking about cents, it starts breaking down. It don't end up being a whole lot of money a year, but you act like it's a ton of money a year. But see, for every penny you save, you get a bonus. So if the nursing department saves money in staffing, the CNOs or DONs, they get bonuses for that. That's how these incentive programs work for the upper management. And you're wanting to cut our pay. You want to cut everybody below you's pay so you can keep getting your pay. You think you got a problem now? You don't. You hadn't seen it. You hadn't seen what's happening. I'm asking that the organizers out there, if y'all catch wind of this video, I'm asking right now that you change that United Nurses March or the Million Nurse March or whatever title you got to the Medical Million March. Because we all know as nurses, they're going to cap our pay first, but it's time we do exactly what we say we do every time we work. People under me, I try to make sure they're taken care of too. Well, let's do it. Let's invite them all. You want to get 1 million people there? Get the Medical Staff Workers of America. Call on them. You might be surprised how many environmental employees show up and how many dietary employees show up. You'll get your 1 million, and then you'll get more than that. You'll get way, way more than that when you start adding everybody in every part of the hospital, because we're all in danger right now. It's not just nursing. We're all in danger. They want to cap pays. I'll go to work at Hobby Lobby. I've got a loophole. That was going to be my episode tonight, was going to be explaining how to get your LLC. You travel nurses, how to get your LLC and become your own agency. I was going to that, but it's time. First, you got to have a line in the sand. Then I'll tell you how to get around the line. So when everybody but upper management don't get a raise, who's that benefit? Well, of course, that benefits the upper management and it benefits the corporations and the conglomerates because they got less expenditures. They get to keep more money. They get to keep their money. And then they get to tell you you're not worth their time or effort or their money that you made for them. I actually had a CEO of a hospital one time. He didn't know I was a nurse. I'll give him a slide on that part of it. This part I won't. I actually heard him say, I'm going to quote him because I never forgot it. It's too bad we can't have nurse robots. Well, they could work for free all day, every day. We wouldn't even have to have a shift change. And that's when I left the hospital work because that's their attitude. That's the general attitude. If we were all robots, that's what they want anyway. They want us just to go in and function and do and not question a thing. Follow all the policies they say so smart and not have an opinion. Sounds like a political party, doesn't it? I'm going to get to them in a minute. I have so much respect for the hospital workers, mainly because I am one, but I have more respect for the ones that stick with it and go through it every day and don't mind coming in and giving all they got to the people on the floor that's the patients or the residents, because it's all really nurses know how to, including us old school nurses. That's all we know. It's going to be hard to find something else to do. And you're telling me now that you're going to cap my pay because you don't like it? It's cutting into your bottom line. Well, CEOs, DON, CNOs, whatever you want to call yourself this week, cut your pay. Because I'm sure for you CEOs, even in the major corporations, I'll let you keep $2 million of it. But how far would that $8 million go? Let's say you make 10. The HCA guy, hell, he makes probably 13 or 14 million a year. How far would 10 million of that go, boss man? How many nurses could you, how many housekeepers could you? How many laundry people could you? How many housekeepers could you? And I'm going to go on now to the politicians. Government's fault. And I say government because I'm collectively bulking them together. And that's what I'm going to. I know, baby, I know. That's kind of a new number that I saw. But okay, so the HCA CEO makes $30 million a year. Jesus. How many nurses could you hire for $25 million a year? And HCA is one of the main ones griping about the agency pay, wanting the Federal Trade Commission to look in. It's not. Mr. CEOs and corporations and conglomerates, listen real close. It's simple basic economics. If you got a large supply and little demand, your price drops. If you got no supply and a large demand, you're going to pay. You're finding that out. The market is now determining what we make. Those days are over with. The market don't get to determine what we make now. You caused 500,000 nurses to quit. You caused 500,000 nurses to quit since the pandemic began. And now the Labor Department's new statistic is that 1 million of us will be out of this business by 2030. And you can't produce but 188,000 nurses a year. It doesn't take a genius to figure out supply and demand. And these bumping up nursing schools like you did to fix a shortage in the 80s didn't help you at all either, because we're shorter now than we were then. And you were pumping out nurses on every corner from all these schools, and half of them weren't worth a crap. They didn't stay. That's why I say about 90,000 a year stay in it. 90,000 new nurses a year for 330 million potential patients. Those odds are not good, and they are not in your favor. And that's simple supply and demand. That's most elementary. And I didn't even have to go get a degree in medical management for that. Idiots. There are articles dating to before the pandemic about the pending crisis in healthcare. But the government did what they always do. They ignored it. They allowed, I'm getting to that, Karen. Don't get my cart in front of the horse, babe. I'm fixing to talk about it right now. Government fixed it to where these companies could go to other countries and get cheap labor. They went and got robots. I mean, that's what they were looking for. The problem is, we get in there, they come to work with the Americans nurses, and we corrupt them. They end up being some of the best workers you'll ever work with, but then they learn that breaking the wall, breaking the rules, and bending the rules to fit the patients is what you do. That's how it works. So here we're sitting on the verge of a collapse of the medical industry. And the almighty government doing what they do best, going in there and trying to see how they going to benefit monetarily from it. I'm going to benefit monetarily. I just don't know how I'm going to, but we'll figure it out. We did before. We got the government talk them into letting us bring in nurses from the Philippines and the islands and bringing them over here to work with all of them. That cut our costs significantly. Then I can get my bonus of $500,000 this year because I saved $1.4 million, because we all know it's on a percentage. And the government allowed this to be able to take place because the government chose to listen at this point. They chose to listen to lobbyists. They have chose to listen to people other than the industry, people that work in it. Companies are worried that they might have to recreate their business plan to stay afloat. That's not even what it's going to be. What's going to happen is, while you're trying to change your business plan and you're trying to figure out how, once again, to keep nurses on total making less than $10 an hour, and I'll explain that in a minute. People are going to die because whenever there is education about healthcare out there and people's health, your government works with your media and you block the information from being, it's out there, but it's hard to find. That's your fault. Everything regarding this pandemic, since they're making everybody mandated to take these shots, all the information should be transparent, every drop of it. All of the numbers should be public knowledge at the end of every week. This many given, this many adverse effects, this many reported effects, these many unintended outcomes, including death. Every week. The public ought to have that information. It's a public shot, so it ought to be a public information gathering experience for everybody. The ones at the top of this problem, the government, they make rules and regulations and they put CMS in charge of it. And CMS goes out and they make sure they survey these buildings, or they get joint commission surveyors, and the hospitals have to pay for those. And they get out there. They don't see what we see. They don't see someone's loved one sick, needing care that they can't provide for themselves. Excuse me. or they might need some compassion and understanding for what they're going through. It absolutely sickens me that the love I have for my career started out as a dream, is now a nightmare. I used to go to work and leave and felt like I had done something. Now I go to work. When I leave, I feel like I've been beat down and stomped and kicked and hit with a baseball bat. We feel defeated at the end of our shifts because we could have done more if we just had the time, the people, and the help we needed. But you politicians are supposed to listen to the people and the people that's doing the jobs, and you don't. You've chosen to listen to the corporations and the lobbyists because they're the ones that can put the most money in your pocket. Now I'm fixing to give you my personal thought. So here we are. This is a conglomerate put together by nurses from all over Facebook, TikTok, Rumble, Parler, Getter, Locals, all of my little platforms I've got everywhere. And I agree with what I'm about to tell you. People keep saying there's a nursing shortage. There's not a nursing shortage. There's not. There's a retention problem. You got a retention problem because there's a shortage of nurses willing to be abused and taken for granted in what we do for a living. Nurses are leaving the bedside. I hate to sound like in swarms. I've seen them go for a lot less paying jobs or even across making the same amount because they don't have to deal with the stress and abuse of trying to care for human beings in a customer-driven private healthcare network. We work for profit. We're getting you the profit, and you don't want to share the profit. Your business is led to greed for profit management. You're turning the nurses into Robin Hoods, guys. Nurses give new meaning to the word Barry and Peter to pay Paul. We do it all shift, every shift. All shift, every shift. Have to hunt medicines down. Have to hunt over the counter stuff down. If not, go get it ourselves. I've done that for my residents in the nursing home. I'm not selfless. Nurses generally aren't. We have an innate need to be wanted. That's just how it is. We've been screaming for safe work environments for years. And the only thing the facilities answer for it is they've done a real hard job. I think they might need a slice of pepperoni. We're sick of pizza. And to the people in public that order food in for the staffs of these hospitals because you love it, thank you. That pizza tastes different than the pizza they get, I promise you. Donuts, y'all can never go wrong with donuts. Never. Just send plenty. If you think 2 dozen is enough, try 4. Nurses will swallow down a donut in a minute. Corporations, the CEOs, the groups that's supposed to be such partners, the government itself, They only see money. If you want this to stop, you want this bleeding to stop, and you want it all to quit, stop ignoring us. Listen. Listen to us. Turn your business plans around. Start talking to the nurses and asking them how to change it. We can tell you because we're the ones that still in touch with the people. You're not. CEOs aren't, and the government sure the hell ain't. They get a business that says, oh, well, this is how we're going to borrow Peter to pay Paul with this policy. And if they don't meet that policy, then we'll fine them until they get it corrected for $1. But they're going to fine you 10 or 12 or 14 times, however much they think. Is they'll hold it off and approve it till they get as much money as they want out of it because they've already give you the money. Then they're going to get it back through the fines because you got to pay the fines with the money reimbursed to you from the company, which is CMS. So that never ending cycle, always a never ending cycle. So in general, the problem and why you're seeing what you're seeing is the government and the corporations, for-profit healthcare facilities, and the lobbyists all working hand in hand to undermine everybody else in healthcare. That's what it is. So I'm going to read part of my post from Facebook. I'm going through every one of them because these posts are from nurses. These posts are from nurses that have seen this. I've seen most of this. I've done all of this more than once. And I want you CEOs that hear about it and you government officials that know about it but don't do it yourself, pay real close attention. If you've never zipped a newborn baby into a body bag and carried it to the morgue, and you don't get to decide how much nurses make. If you've ever had a patient beg you that they're going to be okay, and you got to reassure her while you're watching her bleed out on the table that she's going to be just fine, and you do everything in your power to keep her alive, and it don't work, you don't get to tell me how much I make. If you've never had to climb on top of a woman and get her baby's shoulder unstuck when she's delivering the baby so you don't deprive that baby of oxygen, and it has a developmental issue, and you do everything in our power to get that baby out of there without causing damage and harm to the baby and the mama, you don't get to tell us how much we make. If you've ever told your family members your shift was fine, just to spare them details of what you saw that shift, you don't get to tell me how much I make. If you've never seen a child come into emergency clinic, beat the hell to death, begging for you to make it stop, you don't get to tell me how much I make. If you have never had to watch a man bring his wife sick with cancer into the emergency room, to have him drop dead in the lobby and then have to go tell the patient her husband is dead, you don't get to tell me what I want. You don't get to tell me how much I make. And you sure as hell don't get to force it on me anymore. I can't read any more of these. Too close to home. So let me tell you, if you're not aware that nurses get PTSD, depression, and are starting to commit suicide at an alarmingly big rate, that's where you're wrong. We do get it. I'm living proof of it. Nurses get PTSD, depression, and committing suicide. And we can't do a thing about it because as soon as you mention it, everybody's going to go after your license. It's just the way it is. That's what healthcare is evolved to. Because if they can go get you out of the thing, then they cut costs. You see, that's how it works. So if you want to fix a collapse in healthcare, it starts at the very top. It starts in DC. And apparently they're not listening to good enough now. So maybe they'll listen when there's over 1 million of us up there griping at them and telling them, get with it. Quit worrying about Democrat and Republican. Quit worrying about your politics. It can be fixed. It's real easy. Open a pipeline. Get oil flowing. Lower the cost. Salvage these jobs. Agencies are fine. I've an agency nurse for years. They're absolutely fine. They can work. Most of them are really good and really fast and can go in cold and work. But the continuity is not there. And I'm not even going to lie about that part. I've been an agency nurse for years and years. I traveled years ago, long-term travel. Now I'm just doing per diem. Still a traveler. But most importantly, I'm still a nurse. And that's where it's coming to. These things, these are just a little small list. This ain't even a big list. This list ain't nothing to it. You don't cap our pay until you hear what else we want first. But then you want to cap our pay. Let's make it reasonable. Every patient, how much you bill, then how much a nurse is going to bill you. Because if nurses get these LLCs and these PLLCs and they start independently contracting themselves, there's no FTC violation. The independent contractors, everybody is. It's going to be part of nursing school. You go to nursing school for 4 years, 3 years, 2 years, 1 year, whatever the case is. Then you got to go take a course and leave to be a paralegal so you can set up your own LLC. Well, then you got to pay us for all of that. It's still going to be the same expenditure. It ain't going to change. All nurses want a hospital, especially this is like safer staffing ratios, guaranteed safer staffing, guaranteed. Every shift has to be covered the same. If in the hospital and med surg, it's 1 to 5, it's 1 to 5 everywhere in the country. And ICU, if it's 1 to 2, depending on severity of the ICU patients, 1 to 2 only. If it's in the ER, it's 1 to 2. But you got ICU patients waiting for beds and you've got med surg patients waiting for beds, those get their own nurses. So the ER nurse can keep their 2 ER beds flowing. Guaranteed. Not hard. Not because we're lazy either. It's because when you get to that kind of staffing ratio, you better believe you me. And ER, I want it 1 to 1. I was an ER nurse. And I'm an LPN. But what I did was I took care of all those outpatient, inpatient people waiting for beds, even the ICU ones. I did everything. That's how I learned so much. And all those nurses I work with in Monroe, Louisiana, and North, and at the Main, and in the ER, I miss all of y'all. I learned so much that when I did that, I appreciate y'all. Y'all don't even have a clue how much it's helped me in my career. We want pay that reflects the services rendered. And this is the biggest one of all. Number 1 and 2 is for the politicians. Number 3 is for the CEOs and these major corporations. We want across the board pay raises for general staff across all the healthcare gamuts. Or even the resident physicians, RX, respiratory therapy, physical therapy, occupational therapy, speech therapy, CNAs, radiology techs, environmental service workers, dietary workers. You see where I'm going? What's supposed to be the platform of healthcare needs an across-the-board raise, and what we need to cap is the CEOs and CFOs and board of directors pay. And I'm going to give you a number here for that. Let's cap it at $200,000 a year. That's plenty of money to live on, be comfortable with, and save money and be a millionaire if you want to be, but not be a millionaire off the back of Americans, off the back of the insurance companies, and especially off the back of the government. We want crisis and hazard pay during the ongoing pandemic and any future pandemic type seasons. And I call that the flu because we all know about every 3 or 4 or 5 years, the flu wipes us out because the strain gets missed. That's how it works. Worked that way for years. I've been doing it that way for years, and that's how it is for years. We want financial penalties to the hospitals and the long-term care conglomerates and the CEOs that don't hold up safe practice measures within their facilities. That includes staffing. We want adequate amounts of PPE. In 30 years in this business, I cannot believe I'm having to reuse, even now, reuse gowns for the real stuff, not the COVID, for the real infections. In the beginning, I was kind of leery of COVID. Now I don't. I still worry about TB more than I do COVID. Because we're so caught up with COVID, we overlook these other small little infections that'll kill you, like TB and Legionella and all of that. We overlook all of those. They're not important anymore. I mean, it was such a strain put on during flu season last year. I didn't even do flu test. Flu test stayed in the backs of the labs. And all they did was COVID testing because that was the monkey money maker right there at the time. Benefits for all of your hospital employees that actually make healthcare affordable and accessible for your employees and your staff. So you're not robbing them to pay their own medical costs, and you're not paying any of it. If you bring them on, it's a benefit. It's a quirk of the job. And every single person you ought to pay for theirs, period. I get the point of cost sharing when you got a spouse and kids and their family to put on. I get that part. But far as general, no, quit putting off all your costs onto the employee because it doesn't matter. It don't care. You're breaking the bank. That's how we end up getting screwed in all of this. So make the benefits affordable for your employees. And put all caps. If we're going to cap salaries to the government, you cap CEO, DON, and board of director salary for these healthcare maintenance organizations, these PPO organizations, the hospitals they represent, and everything else. Take money you save in caps from that, turn it around, and you make sure that money has to be put into the employees' hourly rate and benefits packages. Because for years, the basic medical staff has been underpaid, undervalued. Nobody cared. Now that we're on the brinks of collapse Everybody realizes that when they were clapping in the street during the middle of COVID, they didn't know they were going to watch their armies fall off to the side and desert and abandon ship. But that's what's happening. And it's happening because you can't do something about it, because you won't do something about it, because the CEOs and the lobbyists have padded your pocket so much in Washington, you don't care about it. And the only way you're ever going to care about it is if we do something about it from the ground up. Because what the politicians and the people in DC fear more is people realizing that we're more than them, we're bigger than them, and we're stronger than them. And it scares them to absolutely to death. Now that healthcare is on the brink of collapse, let me start where I was left off. Everybody all concerned because there's some nurses out there making more than $100 an hour. I can assure you, I'm one. Not every travel nurse makes that much. In fact, most of us make way less than $100 an hour. Not that what I make is bad, but it's just not what I'm seeing everybody across the board. Yeah, there were contracts out there that they were paying $10,000 a week. They sure were. Now they're trying to drop them. Well, it's not going to work too well. I'm hearing nurses canceling contracts in the middle of the contract. Because if the facility has a right to dump you and cut your contract in the middle of it, the nurses do too. And the facilities and the agency people that are blackballing their nurses because they did that, good luck on getting some back, because nurses talk to each other all over this country. Somebody knows somebody that knows somebody, and that's how it works. Most of us make way less than that. Why don't you focus on the small minority of nurses making that money? Why don't we shift gears just a little bit and focus on why nurses are leaving for travel or agency? Why they're walking away from their jobs? Why they're walking away from a good income? It's not that they are. It's that it could have been avoided. Maybe because you ask us to do more with less all these years. Maybe it's just from this terrible staffing ratios. The reasons are really endless. I could come up with 100 other more things to talk about. So why don't we start worrying about nurse retention and fair wages and safe staffing and everything else I've talked about? Because in 2030, there ain't going to be no nurses left, because there'll be over 1 million of us gone. Why ain't we worried about that? When does it stop? When is it ever going to stop? When are you going to listen? Because by the time all the nurses quit showing up for work, it's going to be way too late. I want to thank everybody that's tuned in and watched tonight. I'm going to end the stream now. I'm not sorry that I got emotional. I mean what I'm saying. I love what I do, and I hate to see it stop, but that's where it's going. So this is David. This has been Ridge Runner Reports. Everybody have a good rest of the weekend. Enjoy the Super Bowl. But most importantly, take care of yourselves, your loved ones, and each other.